some of them are a little bit long, and you can sort of, I wouldn't recommend doing it all in one sitting, otherwise you'll go insane. But they're about 20 minutes each, so you could do like one a day, and they're quite useful to refer back to. So this is just pelvic floor health. It's on the Alberta Health Services website, and go on the patient education tab, and that will give you that information. Another useful website that has information about pelvic floor is called Your Pelvic Floor, is it Your Pelvic Floor Health, or is it yourpelvicfloor.org? Yeah. See if this brings up the right thing. There we go. So if you Google Your Pelvic Floor, and these are information handouts that are developed by the International Urogynecology Association, and they have patient pamphlets that you can download on different conditions. So if you click on the patient pamphlet tab, download leaflets, they have a bunch of different leaflets about all sorts of different pelvic floor issues. So that's yourpelvicfloor.org. So those two sites, Pelvic Floor Health, Alberta Health Services, and you click on the Education tab, and yourpelvicfloor.org.
One other thing I just got asked a question about that I didn't mention was that, yes, our clinic is a referral-based clinic. So, that is a question that's come up a few times. So it's very important because of the continuity of your care, right? It's not a cure. It's that we can help you manage, and that's why we need to help you with your family physician needs to be part of this management. So you would go to your family physician with your concerns, and then they would send the referral into our clinic. From there, and then the clinic is the referral is then triaged by our physicians, and then you come into us. The other question that was asked is that there is a wait time for our clinic. So if you are looking for physiotherapy, our wait time of our clinic is about a year to 2. So it is really important that I still think it's important, and there are physios that have done training but you would have to go to a public community clinic. Some of those clinics still have some funding offered, so you can ask about that when you're there. And I think that's probably all I'm going to say about that for now. Okay, we'll just go ahead and answer some of these questions.
I have two that just in follow-up to what Sarah had said, that yes, we do need a referral. Somebody had asked. You can't really bypass your GP. You do need that referral to come in. Unfortunately, it is a bit of a wait list, but once you get through, we hope to help you get to the point that you want to be at. So I have a question here. How do you prevent bladder infections, even if drinking lots of water, but not able to always empty the bladder? Again, that would be something we would probably need to see you and assess, but if you're not emptying your bladder right, possibly pushing it up with a pessary or doing some of the other things might help, but that would be something kind of based on each person that we'd be checking. Can a Vagi cup be used for support as while you're golfing for a grade 3 bladder prolapse? A Vagi cup may provide some support, but it's not ideal. Again, that would be something that would probably be better suited with pessary. Okay, pessaries are a little bit safer to be wearing long term. And then Sarah, this one here. So lifting 15 pounds with prolapse. What's your weight?
Okay, so because gardening's coming up, right? And so I always think about that it's not always so much how heavy it is, it's the way that you are lifting it. So there are things like if you can, generally speaking, right, because it's hard when I haven't seen you, but keep your legs a little bit closer together so your base of support is not as wide, right? So your feet are about hip width apart. When you're bending down to lift something, try and breathe as you're lifting it. So if I'm really struggling to lift 15 pounds, then that's too heavy for me, right? So if you can bend down and lift it and you can easily put it back down, I think that might be a better way to think about it versus the weight. The other thing is really try and close your vagina. Think about those sit bones. Think about lifting your pelvic floor up, lift up the pot, hopefully the small pot, and then put it down. But truly, we just don't want you straining. If you're really trying to grunt and lift whatever it is that you're lifting, I really think that you should get some help because you're probably pushing down, and if you have that prolapse, that's going to aggravate those symptoms.
Yeah, that was mine.
Another question was, do I need to take a pessary out for x-rays? No, you don't need to take a pessary out for x-rays. It should not show up because it is made of silicone. I've been told that I need Vagifem to moisturize if I should be fitted with a pessary. Is this necessary? It's not necessary to be on Vagifem, but it is necessary to have good vaginal tissues, okay? So if you are past menopause, then likely your vaginal tissues aren't optimal, and you would either be treating that with a vaginal moisturizer or a vaginal estrogen. So vaginal estrogen is our go-to. Some people it is contraindicated, so you would talk with your family doctor about whether or not you can be on that. But if you can't be on that, a vaginal estrogen or a vaginal moisturizer has no hormone in it, and you can buy it over the counter. So one or the other you should be on to make your vaginal tissues quite healthy and moist. Just because of pessary, it is rubbing, it is in there. It can cause sores if that is really dry. Think of something rubbing on dry skin. You're more at risk for sores. Okay, so we want healthy vaginal tissues if you're thinking about a pessary.
Vaginal weights, because this one is a couple times. Okay, so vaginal weights, yes and no. The thing is that if you think about this just with orthopedics, because I think sometimes it's easier. So if you're thinking about making your arms strong, you're going to lift a bicep curl, like you would lift a weight like this. So watch my muscle belly. Lengthen and then get shorter. That's how a weight should be used, right? The problem with vaginal weights is that you're told to just put them into your vagina and go vacuum. So now my contraction is just holding like this. Do you see? So then this can lead to problems where you have an overactive pelvic floor. And if you have symptoms of prolapse, your pelvic floor is already working quite hard to support your prolapse. And now you're adding the weight in there. So this would not be a good thing for you. But vaginal weights used with a different protocol would be okay. So if you want to think about that as a form of feedback, I think that's fantastic. So then you would lift the vaginal weight, hold, and relax, lengthen. And then you would get stronger and you would do a set of 10 like any other muscle belly. So just really try and think of all those things that you do for other muscles, because your pelvic floor is a muscle belly, just like your biceps. There's some other things that you can do to make it more specific to you, and that's probably the best conversation to have who's ever treating you. But generally speaking, I would say that.
Another couple questions about pessaries. Inserting a pessary is okay. Removing one is painful. Any hints? Hints, first off, I would try using lots of lubrication or try different positions. If you're still having trouble, you would talk to whoever's fitting you with that pessary about if that's the only option, if there's something that might hurt a little less, or for tips on how to get it out without hurting. We don't want a pessary to terrify people when it comes time to remove it or put it in. We always hope that it's comfortable and that part's going to go quite easy for you. Okay? Sometimes it is a little bit uncomfortable, but if you're doing it yourself, just talk to whoever fit you about that. Okay? How often should a pessary be taken out for cleaning? And how often should they be replaced? A pessary can last as long as it looks good, it's not cracked, and it can be over 10 years, I believe, they say, for the life of the pessary. It should be taken out once a week if you know how to do it yourself, every 3 months if you're not able to do it by yourself. If it's something that's being taken out every 3 months, we hope that a provider is looking in every time just to assess your vaginal tissues, okay? And Some pessaries do have to be removed for intercourse, but not all of them. Okay, some people can have intercourse with it. It is preference and also based on the type of pessary you have.
So you can see what we're doing here is we're consulting each other, and that's what we do on a daily basis in the clinic if we're not sure of how things are working. And there's 6 urogynecologists, and we're always talking to each other about how to fix things. So some of these answers we may not have. So one of the question was, can you elaborate on causes that could be different in ethnic groups? So what we meant with by that was that from statistical studies, in some studies where they separate out different ethnic or racial groups, they have shown differences. For example, in African Americans, a lot of the American studies separate that out. They'll find less problems with incontinence and prolapse. And in Caucasians, there's more. So it's more likely probably just something based on the genetics of collagen metabolism of the stuff that's stretchy. So what doctors prescribe laser treatments? Are they not doctors? What do they say the laser will do? My sister said she consulted someone to charge her $5,000 for the procedure, and red flags went up. So lasers have been tried on different things, and usually they don't work, so then they're tried on other things and sold to different doctors to try them for different things. So I actually wrote a letter to the editor about this recently, which is published, because lasers have been promoted, and they are being promoted in this city for treatment of urinary incontinence. And when that's found out in the last few years, it doesn't really work so well. Now they're promoting it to treat dryness or symptoms of menopause, which to me seems kind of illogical. So the federal, the FDA in the States put out a warning about laser treatments, that there is, if anything, only short-term studies to show any benefit. So we don't know what will happen if you're frying your vagina down the road. We have no long-term studies, and almost all the studies have been done by the companies. So that's always a little bit of a worry. I've had patients that have told me that doctors that work in this city would not treat them until they tried their laser first. So I think that's also a bit of a red flag. And I think we're fortunate that we're in public health care, because we are so busy that we have a long waiting list, and we don't have to offer things like laser to improve our eco. We've got way too many patients to see. We don't have to worry about that. But I think that's come from a private perspective. So I am kind of annoying and on my soapbox about this, but it really upsets me that patients are offered things that have no evidence-based medicine behind them. Is a tilted uterus the same as prolapse? No, a tilted uterus is called a retroverted uterus, and it just means the position of where the uterus is pointed in the pelvis. So the uterus is pointed down or up, and it's really a non-issue. Just maybe something that your doctor might notice when they examine you. Urinary incontinence and urgency. Is Botox a good solution? So yes. So urgency incontinence is a symptom where you get a sudden urge to void, and then you just can't stop it. And we usually start all the same thing. Our nurses start right from the beginning with things like eliminating caffeine, looking at what your fluids are, and that kind of thing. And then you go to things like medication, and things like vaginal estrogen can help. And then so Botox, which is injected in the bladder with a cystoscope, is considered more down the line, but it can be very, very effective treatment. How does VagiFem help? VagiFem is vaginal estrogen, and especially in perimenopausal or menopausal women, the vagina can get very dry, so you start to get discomfort with intercourse, and it helps increase the blood flow to the vagina and keep it lubricated. For pessaries, when we looked at that study that looked at over 1,000 women, we found that if women were on vaginal estrogen for a month or so before we tried to fit the pessary, you're more likely to get one there. Because it's not dry, it's a little bit more flexible, it's stretchy, and you're less likely to get complications like erosions from the pessary rubbing your vagina if you're on vaginal estrogen.
Couple more questions about pessaries again. If I end up in a nursing home, or our healthcare worker is going to care for me and my pessary. We have many women coming from home care facilities, and they're either brought in by their family or they have doctors that visit there. There is providers trained in the community, and so if you're being placed and you're worried about that, that is something that you could bring up ahead of time, just if there's somebody that you can access or somebody that can go, one of the doctors or providers, or how you will get in for that. So often, sometimes the needs for pessaries decrease as you age and your mobility is less. So sometimes people wear pessary for years, and as they get older, they don't actually need it as often or as much as they once did. So check that. Is it better to go to the washroom as frequently as you think you need to, or better to train yourself to wait a bit longer? It's one of the things I didn't really touch on, but there's a few things you can do. You can wait too long to go to the bathroom, and you can go too frequently. So you never want to go past 3 to 4 hours. Women, especially, there's a lot of people in certain fields like nurses that come in later because they have problems because they've held so long. So don't hold past 3 to 4 hours. Make sure when you're on the toilet you take that extra couple minutes. Don't rush. Like Sarah said, we're all busy. You want to actually relax. You don't want to be straining to pee. You don't want to be pushing it out. And you don't want to be rushing yourself. Okay? Take that time. It really only takes an extra minute. Empty your bladder. If you are going way more frequently, you are a bit in control of that as well. There's sometimes other things going on that that would be different scenarios. But if you're just emptying because you feel it right away and you rush, you kind of train your bladder also to rush. So your bladder capacity can be smaller or larger based on it, but that is not always cut and dry. So there's other things that we do have to assess if that's happening.
Oh, you guys, it's so exciting. Look at all these questions. I think we have a question for like every single person. I mean, it's pretty great. Okay, do Kegel exercises benefit if you're leaking between the bowel and the bladder? And yes, absolutely. So, I think with this, it might be the best thing to think about is as we're aging, we lose our fast twitch fibers. So this is like geeky physio stuff, but we have slow fibers. This is how I explain it to my patients. So if you think of a chicken, you've got the dark meat in the chicken, right? And you got the white meat in the chicken. Does this make sense? If you think of a sprinter, they're like thick and bulky, and you think of a marathon runner. So the way we train those muscles affects the way that we use them as well. So for our fast twitch, so those are like our sprinters, those are the first things we start to lose as we age. So I would recommend just trying to connect to your pelvic floor. Just wink your anus, lift your labia. I know that they're just anatomical terms. Just think of them like that, and that will help you. At least get started and wake up the areas in your brain that help you with that quick reflex. So yes, they help. Okay, would Kegel exercises be helpful for someone having problems with internal hemorrhoids? I would say that the hemorrhoids, when I see it, to me that says
Code
that you're
yellow,
straining.
phase 1, patient Hazel,
Everything
please
that
return
happens
to
in
unit
life,
2 west.
So
Code yellow, phase
straining
1,
is not
patient
good,
Hazel,
right? So
please
that's
return
where I
to
would
unit
even
2 west.
recommend maybe getting your
Code
knees up,
yellow, phase
right?
1,
And getting that anal
patient
canal
Hazel,
into a
please
better
return
angle
unit
to
2
empty.
west.
So that would be very helpful in preventing the internal hemorrhoids then. But yes, doing pelvic floor exercises because it keeps your muscles strong. But I think there might be a couple things with that question. Okay, this is a big question. It's a little tricky to answer. It says, could you speak to the effectiveness of hypopressives to treat or decrease prolapse symptoms? Ooh, hypopressives are a hot one right now. My answer to this is the evidence for doing hypopressives is not significantly, it's not very strong for pelvic health. And what I would say is if we just look at it based in science, we've been doing pelvic floor exercises, since the 70s. And there's been so many replicated studies on pelvic floor exercises being helpful. So I think that, yes, a hypopressives may help. I think that there is a lot to do with the way that we breathe and the pressures on our pelvic floor. But I really think you've got to learn how to use that muscle, and then you could do other things. It's sort of like, yes, I think yoga is very helpful, but you've got to learn how to use those muscles for yoga to continue to be helpful. So to me, it's another part of the treatment. Do you have recommendations for folks who want to keep running with grade 1-2 prolapse? And this comes up, I have another question like this one too. I love to run, and I very much want you to be able to run happily with your vagina when you're 58. So if you're having symptoms of prolapse when you're running right now, that tells me that your pelvic floor isn't quite strong enough to support those tissues. So I think about that is if you had a knee injury and you wanted to downhill ski. I would say yes, but you need to brace your knee. So you would wear a brace and you would go downhill skiing. So if you want to do running and you've been diagnosed with a prolapse, then I think, yes, you should run, but you need to support your prolapse, or the running and the weakness of your pelvic floor may lead to it getting worse instead of better, and then you can't run later. So, or you could, but it'd be uncomfortable. So that's where I really think that you would want to have a pessary inside when you're running. For the person who asked a similar question, and they're about a year postpartum, I would say that this is really a fantastic time for you because your body's going through all these changes, but we also, in the way that your hormones are going to change. So one, we want to be strong from the inside out. So you've got to get in and see somebody and make sure you're doing your Kegels correctly. And then two, if you feel those signs of prolapse, I would definitely go see your physician and get a recommendation for a pessary at our clinic to see Terry. But in the meantime, you could use something like an Impreza or a tampon and just try it while you run. So the Impreza is this, what Dr. Flood has. It's not perfect. It's just like a robust tampon. But it can be really helpful because we do have a wait to get into the clinic. So if this was me, I would do those online modules with pelvic floor education and about the pessary and prolapse, because then that would be a helpful introduction. And then you could go to Rexall, Shoppers Drug Mart, any of these superstore, and you can try the Impreza. It's over the counter, and you wear it while you run and see if it helps you. You do need to make sure you take the Impreza out. It's just like a tampon. You don't want to leave it in for more than 8 to 12 hours. Whereas a pessary, we can leave those in for longer. But then I would say, you've got that. You're going to feel supported with your tissues. Do your Kegels, and then you can run happily when you're, I don't know why I picked 58. It's because you said you were 58. So you're 58.
Okay. I always like to tell my patients that pessary is kind of like a good bra. You want it really comfortable and fitted well, and it helps support things up. So do the same thing in a different area. Another question we have here is, new shopping malls have huge bathrooms extremely far apart. Is the only solution to wear diapers? Again, we're going back to going to the washroom too frequently. If you can't make it through the mall, we want to see what else is going on. Definitely diapers aren't the only solution. We would like to improve that incontinence and improve the length of time that you're able to hold that bladder. So again, that would be looking at everything else altogether. So that would be as per each person, and we'd want to start with conservative management strategies. That website that they showed you has some good places to start. Fluids, 8 to 10 cups, ladies. 8 to 10 cups of healthy fluids of water, and try to decrease all that caffeine. First thing you can do before you come see us, okay? I had TBT surgery about 12 years ago. I have leakage again. Will Kegels help, or is surgery my only option? My doctor suggested she could prescribe something. Will that work? Is that a good option? Medications, again, based on exactly what the leakage is. There's different types of leakage, so it would be depending on what kind of leakage you have. Medication does work for some, but again, it would be just like we're starting over again. There was that high reoccurrence of needing surgery again, but you can come right back to square one, start with conservative management, start with the pessary, and see if that just makes things better. So, not only surgery is an option again.
I need to see the Terry, maybe this one. This one is a good one. I think it's important that after tonight, you don't all feel like you have pelvic floor dysfunction, because everyone's gonna be worried. So one question is that, are women weightlifters more prone to prolapse? If you are a healthy, fit body and you've been doing this, you're not necessarily this it's just we're talking about this tonight because nobody talks about this, right? So I think that the lifting, like I said before, is more in the way that you lift. And so if you're able to lift and you're able to easily breathe through your exercises that you're doing, and you've been doing those for a long time, then no, I wouldn't say that would be a link to prolapse. Yes. Well, yes. We just don't, I guess that's the yes. Like we just don't know. It's such a general thing. We have to see who the person is and how you're lifting, and then we would look at what's happening with your pelvic floor. That's probably the most honest answer.
As she was talking, I was thinking here, it's a good thing we have a few men in here, because now when you all go home and the women won't lift anything, we know why, right? Everybody's afraid of lifting. Does a pessary affect an IUD? So I have many, many women with IUDs in and pessaries. It's not to say that no pessaries can affect it. I think the Q has maybe a little higher, maybe not. But yeah, so you know, the IUD does have a little string out, so you would take a little extra caution, but it should not affect the IUD at all.
You guys need to leave, we won't be offended. So this is a really sad one. So this poor patient waited 18 months to get to see us, and then she was put to the Misericordia site, and she was supposed to get a pessary next week, and now it's postponed until September. So the reason is poor Terry here is filling in is because our nurse at the Mis fractured her pelvis, and our other nurse at the Mis is having surgery next week for something else. So we're kind of shut down at the Mis. So those poor person, it is 18 months to see our nurses here. So make sure you've done the modules, but also if you want to secretly give me your name and date of birth, I will work miracles and get you squeezed in. So, but make sure it's the one that wrote this.
Everybody's coming with their name and date of birth.
Please be honest.
There is a history in the computer.
That's true. What's the chance people will react to silicone inserted into the vagina? Can people with autoimmune disease or other systemic diseases use a pessary? So I've had the occasional woman react to silicone, but it's really rare. I know you're worried about the silicone breast implants. This is an external thing. It's really against skin. And the really nice thing is it's way less common than a reaction to anything we might use surgically, like a mesh. So I've got a lot of women that have autoimmune diseases that can use pessaries. So I would say no, that's not a worry. Can continual douching over the years cause prolapse? First of all, there's no reason to ever douche. Don't ever douche, it's silly. And some people do douche when they have a pessary and they can't change it regularly, especially if they don't have a uterus. It's a safe thing to do to clean out the vagina, but there's no other reason to douche, and no, it can't cause prolapse. It says my mom did this and had a prolapse later in life, so that's probably related to childbirth and genetics, so make sure you yourself start doing your pelvic floor exercise. I didn't also mention those before. Botox for urge incontinence, physio can be very helpful as well. This is a tough one. You guys are, how old is too old to help? Did anyone?
There's not.
Oh, I had that one out to say at the end.
Okay, never mind. Okay. Could a prolapse due to cervical fibroids be treated with a pessary? That's a pretty specific concern. Like, is it actually a prolapse or is it actually the fibroids coming out? So I think that's something you really need to see a gynecologist about. But really, it's like if a pessary can be fitted and it's not pushing up the fibroid too much, possibly, but I've never actually seen that. So it'd be kind of fun to see. I'd love to give me your name. Do you want to say the last thing?
I think all these questions, as I'm throwing them, just kind of show that there's a lot of interest. You know what, women don't talk to women, and I think this is kind of a subject that is gaining some popularity. And you know, don't be shy to talk to your doctor, let them know what's going on.
And it's never too old at all. Like, sometimes that's when you have time to do things. You know, I have, like, last week I discharged my 92-year-old and she had fecal incontinence, so that was really tricky. but you know, she just needed some help with her diet, and then she just needed to learn how to do the exercises, and we did a few other, you know, just mostly with her diet actually, and she was drinking a ridiculous amount of tea. Like, it was incredible how much tea she was putting in her body. But, you know, and she's done. She does not need me. She's very happy. And so 92, I think that she's amazing.
And I have taught women in their 90s to remove their testes on their own without issue. So,
Wow.
it's not, and you're never too, I also hear people say that the doctor said too old is just a natural part of aging, or that you're too old for surgery. Don't agree with that either.
Thanks, guys. I hope that was helpful.
Thank you.